an agency that's really, we're very fortunate actually here in Ontario, because nowhere else in Canada is there an agency like the OHTN that is dedicated to research funding, provincial research funding for HIV. So, okay, great, thanks very much. Okay, so, this one? Okay, so that's who I am. I also, I'm a psychologist actually by training, and my specialty is actually neuropsychology. And so I'm now do a lot of work on the health research agenda for HIV in Ontario, and I'm based as well at St. Mike's and the University of Toronto. And one of the things that I want to do today, the main message actually for my talk is there's really four things. Housing is prevention, housing is good health, housing is good healthcare, and housing is good policy. You all know that. And what I hope to do today is to show you some data that can help you sort of drive home that case. I can tell you from all the research that's been done around the world, in particular in North America, in the US, we're now really embarking in Canada on making this work happen to actually have data in the Canadian context, in particular here in Ontario. But those are the four things. Housing is prevention, housing is health, housing is good healthcare, housing is good policy. And there's all kinds of evidence to support that. Right. So today, I just want to tell you in the next 20 minutes, sort of highlight some of our research findings. This is a very unique study that started about 4 years ago, 4 or 5 years ago. And it's funded by the Canadian Institutes for Health Research. It's called Positive Spaces, Healthy Places. And this is the investigative team. And what's really unique about this team, it's a combination of people from the academic world, people from the front lines, community-based agencies, and actually people living with HIV. So it's a new kind of research that we call community-based research. It's something that has been around for a while, but I think this study actually really emphasizes what philosophically the sort of approach to this really works. And I think this is an example that is being used to show people that this is kind of a method to get outside of the ivory towers of universities, get into the community, and have research that actually impacts in the real world. So that's what this team really has been doing for the last 5 years. It's a very exciting team. When I started, this is around the time when I was starting at the OHTN. I've now been there, we're moving into my second 5-year term at the OHTN. And these people are all the leaders in Ontario. And it's remarkable what's happened. And there's studies like this now happening across Canada because of just the kind of approach and energy and work that's happened from this team. So it's a very exciting project that I love to talk about. These are the people in the agencies, or the agencies that are involved, and you can see that they're agencies, frontline agencies from across Ontario, and including with that universities and hospitals. It's a study that's actually, this is what often needs to happen these days, is you don't just have one funder. It's principally funded by CIHR, our federal funders, but also the OHTN, the Ministry of Health, and the Ontario AIDS Network actually also contributed funding to make this work happen. So what is this study about? So it's now in its fourth, we're moving into our fourth phase. Essentially, we want to study there's about 600 people that are being studied across 5 years. So people living with HIV. And what we did was we wanted to sample, the epidemic is different across the province. And so what we set out to do initially is to say, well, okay, we want to make sure that we get people who are representative as much as we can with our funding of people living with HIV across the province. Different risks, people are at different risks across the province. And so this is the sample that's now being followed over 5 years. We're sort of in the midway mark, about 2.5 years, 3 years out. And it's a study that's often referred to sort of as mixed methods. So we're collecting data, which I'm going to show you in a minute. That's the quantitative side, the hard numbers, the data that's going to really help frontline agencies and policymakers think about, here's what's going on, here are the numbers, here are things and how they're looking across the province. And then the other element to this is the qualitative side of it, is to really to not only to take this data and contextualize it within people and their communities in which they live. So really to get information that helps to take this data and make it come alive. So this is sort of the mixed method approach of using hard data with stories, and that's what the kind of approach that we've been using across the study. Just to emphasize that community-based research, this is, again, as I mentioned, it's a unique kind of research where everyone around the table in our team is an equal decision maker. And this really helps to do a lot of things. It really helps to make sure that the research, the questions that we're asking are contextualized so that they're going to be meaningful to the different communities that we actually are trying to serve. And so it's a very unique way of doing things, but everyone on the table is there to sort of make sure that we're asking the right questions in the right ways that are going to have the most impact. So it's a real sharing of thoughts and knowledge and work to make it really the most meaningful. So this is really instrumental in our work, and one of the things that we've emphasized throughout and in this project is the greater and the meaningful involvement of people living with HIV. So there's members actually of the team that are people living with HIV, the people that we've recruited to help actually administer the interviews, and you'll hear more from James about that work that we're doing on that front. But it's really a model that engages people with HIV in being part of the work that we do and helping to make sure that we're doing it in the right way. So here's what JIP is, and it really ensures that we're making this relevant to the people who are the most affected. So as I mentioned, we sampled across Ontario, the 600 people, and these are the major regions, the four and the places in between.